In this role play, I played the client, Daniel, who was experiencing depression, and Jamila played the role of the CHW who was doing relapse prevention planning. And that's something that you're likely to do with maybe many of your clients, regardless of what sort of health situation they have. We used to think about relapse prevention as used primarily around substance use, but in this case, we did relapse prevention planning with a client who has depression. It can be applied to a client with diabetes or hypertension, arthritis, who's trying to make behavior change. The stages of change theory that you have hopefully read about talks about different stages of change that don't always happen in a particular order, but that relapse or falling back to an old pattern of behavior is just a natural part of the process of changing behavior. And it's something we want to really normalize with clients and help them to anticipate the moment when they may just go off their meds, or they may stop exercising, or they may go back to an old diet that increases their risk for diabetes. When clients do that, sometimes they feel ashamed or embarrassed. They may feel reluctant to reach out for help. We want to really help them to understand that we know that it's just a natural part of the process, that we've been there ourselves, and to really encourage them to think about what they can do in those moments. That may be calling us, it may be talking to family, it could be lots of different things, but we want to include it as part of our work around action planning.